Medicaid is in the news a lot right now with the one big beautiful bill passing and making a lot of changes to Medicaid. So I've gotten the question, if I'm on Medicaid and I'm getting ready to turn 65, become eligible for Medicare, do I have to take Medicare? And I've done videos for years and years and years, and I've said, yes, if you're eligible for Medicaid at 65, you have to take Medicare. But the federal rule says that Medicare is not legally mandated. So this is pure government craziness. So the government says, oh, you don't have to take Medicare. But why is Medicare Mama saying you have to take Medicare? Because if you don't take it, Medicaid is the secondary payer. So if you get sick and you didn't take Medicare, then you might have to pay for what Medicare would have paid for. For example, Part A inpatient hospital stay. So yeah, you should take Medicare. No, it's not legally required, but yeah, basically in reality, it is. The reality of it is required. You're not paying extra for it. Now, with all the changes in Medicaid, many people will lose their benefits or get a lesser benefit. And one of the benefits is the Medicare Savings Program, which allows your state Medicaid to pay for Medicare Part B and part of the copays on Medicare Part B. So, you can check in your state. If there's a lot of people that never even applied for it, they didn't know they were eligible, you can go apply for that at any time. You go to Google and type in Medicare Savings Program and then put your state, and boom, you'll see the income requirements to see if you're eligible for that. Again, that changes every year, and it's going to change. All these benefits are changing with the law. So if you are on Medicare and Medicaid, you count yourself in good company because there's over 10 million people that are in that same boat. We call them dual eligibles. You're eligible for both Medicaid, which is helped primarily through your state. It's kind of a joint program with the state and the feds, but it's different in every state. And Medicare, which is a federal program, which is the same in every state. So you're eligible for both. Then, this is what makes it really complicated because it wasn't fun enough. You could be eligible for a special type of private Medicare plan called a Medicare Advantage Dual Special Needs Program for people on Medicare and Medicaid. It's not available everywhere, but they're widely available in large population areas. So if you're in a rural area, you might not have access to it. But if you're in a nice population area, you'll find some very good private Medicare Advantage plans. You're like, I already have Medicaid and I have Medicare. Why do I need something else? You don't need anything else. You might want something else, which would wrap around both Medicaid and Medicare and give you some extra benefits. Okay, extra, that got your ear, right? What extra? Depends on the plan you buy. Private Medicare Advantage plans are different in every state, by every carrier. They change from year to year. But in general, they are very commonly known to have transportation benefits. You're like, I already get free transportation. Well, most people don't. So for the people that don't have access to free transportation in their community, transportation in a Medicare Advantage plan typically looks like this. You get 24 one-way trips a year to your doctor or to the pharmacy. Some of them will give you Lyft vouchers or Uber vouchers. Some of them have their own transportation. They work with certain taxi networks. But it's nice because a lot of people, especially people on Medicaid and Medicare, they might not drive, or they might be too sick to drive, or the cost of gas is prohibitive, right? So the transportation benefit is very attractive. Dual special needs plans also have the richest extra benefits. So when you would see all those TV ads for years, those ads, Joe Namath and William Shatner, they were on TV every day. They were saying, get the sun and the moon and daffodils and roses and rainbows. Those extra benefits were not widely available to all people on Medicare. They were very misleading, which is why you don't see those ads anymore. It took a while for us to all complain and get those shut down. Those sun and the moon and the rainbows and tulips, those benefits did exist, but not for most people. They were for specifically people on Medicaid and Medicare, for dual special needs low-income seniors and people that are not seniors that are on Medicare due to disability. So those benefits were not widely available for other people, but they were in these type of plans. And the reason they get so much extras is the government gives the insurance companies a lot more money to take care of this population. So it's more profitable for the insurance companies, And the way it's structured, how much money they get, they have to give so much of it back to you in benefits. It's not like they're really sweet and they're like, hey, let's give them $400 a quarter to buy things at the pharmacy that are non-prescription, shampoo, conditioner, toilet paper, Band-Aids, Bengay, whatever you need. They're not doing that to be sweet. They're doing it because the government is giving them the money and is forcing them to give a certain percentage back to you in benefits. So yeah, there are plans that give you $100 a month for that, for over-the-counter special things, anything in a pharmacy, not tobacco, alcohol, or prescription. But all your non-prescription supplements, those are expensive, so that's a very nice benefit. Some just give you money to spend at the grocery store. Some give you money for utilities, specifically earmarked for your utilities. They can do all kinds of things. Some give you money for home health care. That is very, very rare. Less than 5% of plans offer that versus about 90% of plans offer some type of transportation benefit. Again, when you talk about Medicare Advantage benefits, it's different from county to county, widely different from state to state, different from insurance company to insurance company, and then they change every year. So whatever we're looking at right here in the middle of this year is fixing to change in the coming year. But this market, people on Medicaid and Medicare, typically it's worth your while to investigate these other plans and understand how they work. Yeah, the extra benefits are attractive and definitely worth looking into. So I say, do you need anything else if you have Medicaid and Medicare? You don't need anything, but you might want something else. You might want to look into Medicare Advantage, dual special needs plans. Again, they don't cost you extra money. They will have zero monthly cost. You can only enroll in certain times of year. That is another whole topic of when you can enroll and when you can change these plans. That's very much dependent on your state. But everybody can change their Medicare Advantage plan, no matter what type of Advantage plan you have, no matter what type of drug plan you have. Everybody can change every year during the annual election period. That runs from October 15th through December 7th. Now, that's the end of the year. But if you're a dual special needs person, you might be able to change the other 9 months as well. Again, give us a call. We need to know what state you're in and some other things to tell you if you're eligible to move to a dual special needs plan now or if you need to wait till the end of the year. We're licensed in all 50 states. So if you want help, want us to educate you about what these plans look like in your area, how they integrate with your Medicare and your Medicaid, give us a call or just book an appointment. We have a calendar, automated calendar booking appointment. Just go to our website, themedicarefamily.com, little yellow box, tap on it, book your own appointment. We will call you. We do not call strangers. We're not part of the 20 calls you get a day from strangers. We all hate those people. We'd never, ever call somebody unless you specifically asked us to call you. So I know you don't want to give us your phone number because you're like, you're going to sell it to 50 people and make $1 billion selling my data. No, we do not sell anybody's anything, email, nothing. We're a small family business. My parents started doing this about 45 years ago. I've been doing it about 30 years. And the Medicare family helps people, tens of thousands of people in all 50 states. So wherever you live, if you need some help with Medicare, especially if you are on Medicaid or someone you know is on Medicaid, it's very daunting navigating the Medicaid waters alone without then being forced into Medicare at 65 and being faced with the prospect of these additional insurance plans. So give us a call. Talking to us is free. And if you need help enrolling, we can help you enroll in these plans. Again, that will not cost you any money. We're paid as independent contractors by the insurance companies. So our help, our consultation, our enrollment, and all of that is free. When you need help for the rest of your life, you can email our client care team every day. We answer our questions, and you're going to have questions every day for the rest of your life. So thanks for watching. If you learned something, please give me a follow. Thanks. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.